For people with chronic back pain, spine surgery may often be recommended. But how do you know if you're a candidate for spine surgery, and what does surgery and recovery look like? Well, Dr. Patrick Kim, an endoscopic spine surgeon at Tampa General Hospital and the first fellowship-trained endoscopic spine surgeon in the entire region, is going to discuss more about surgery today. Welcome, Dr. Kim. How are you?
I'm doing great. Thank you for having me, Natalie, and thank you for the introduction as well.
Yes.
The endoscopic spine surgery is currently the most advanced form of spine surgery. Throughout my training, I witnessed the evolution from traditional open surgery to minimally invasive type surgery, and the endoscopic spine surgery is the pinnacle of that progression. So if you look at the endoscope, this is a portion that gets introduced to the spine. So you can imagine the small size of the incision that it requires, right? So with a smaller incision, that means faster recovery process, healing, and less pain, less blood loss, and less disruption for the spine. So my patients are able to go home the same day, and we are proud to be the first in the region to offer a comprehensive endoscopic spine surgery program.
I go home the same day. That definitely caught my attention, along with a lot of the other things that I'm glad we're going to discuss. What kind of conditions, though, are we talking about? People who may get that recommendation to have spine surgery.
Yes, great question. So very common conditions such as pinched nerve or sciatic pain, lower back pain, neck pain caused by herniated disc or spinal stenosis or pinched nerve are some of the conditions that can benefit from these procedures.
And, you know, I kind of said at the very beginning right there, you know, is there such a thing as a good candidate for this surgery versus someone who maybe this wouldn't be recommended for?
Another great question. So it is very important to note that 80% of U.S. adult population will have lower back pain or neck pain at some point in their lifetime, unfortunately. And as a surgeon, my role is to distinguish who truly needs surgery versus who don't. Having been a patient myself, I understand the importance of that and trying all other avenues prior to considering surgery. So our department has chiropractors, acupuncturists, physical therapists, and pain interventionists to ensure that the surgery is the last option. Unfortunately, in some cases, surgery is the first line of treatment. When a surgery is indicated, I utilize the endoscope as much as possible. And so far, we have treated athletes, soldiers, and patients even in their 90s successfully. And thanks to TGH anesthesia department collaborating with us, we're now able to we're performing awake spine surgeries with minimal sedation, just like colonoscopy.
Really?
Right, to make the recovery process that much quicker, which is a game changer for patients who are too sick to undergo general anesthesia.
Wow. Okay, mind blown there. We've only got a few seconds left, but I do want to go back to what you're saying, recovery, minimal anesthesia, but what does the recovery look like with just the fact that like the opening is so much smaller than what spine surgery used to be?
Right. So traditionally, even with minimally invasive spine surgery, the incision, as you can see in the photo, are usually about an inch or a coin size, but with an endoscope, now we brought down the incision size to a pencil or a pea, as you can see. And recovery time, I would advise a patient usually about a week or two prior to returning to work or sports. But everybody heals differently, so it's catered to the patients.
Wow, just to be able to talk about where spine surgery used to be, where it is today, what is happening in the great work you're doing at TGH. I'm so thankful for your time.
Of course, thank you.
We want to make sure and share the information. If you've got questions, want to find out if perhaps you're a candidate for spine surgery, there's the website on the screen.